Well, good afternoon. Earlier this week, we received a real wake-up call. We saw from the modeling update that if we don't act now to halt these trends, we could see 1,000 new cases a day by mid-October. We could have 200 to 300 people a day arriving in our hospital ICUs. In fact, there are 732 new cases today. We're in a second wave of COVID-19, and as Premier, it's my duty to protect the people. Throughout this pandemic, we have made some tough but necessary decisions, always based on the best medical advice and scientific evidence available. And after consulting with the Chief Medical Officer and the Public Health Measures Table, we will be bringing in more public health restrictions to try to stop this virus from spreading any further. Effective tomorrow at 12:01 a.m., we're expanding the masking policies already in place in many communities to the entire province. That means wearing a mask when shopping, when taking public transit, and when at work if you can't keep 2 meters between you and your colleagues. As much as possible, we also need to limit close contact with anyone outside your households. This will be especially important to consider as we look ahead to Thanksgiving next weekend. We also have to extend the pause on the reopening of any other businesses or facilities for another 28 days. And we are bringing in additional targeted measures for hotspot areas for Ottawa, Toronto, and Peel Region. Effective at 12:01 a.m., restaurants, bars, and nightclubs in Ottawa and Peel must limit their capacity to 100 customers or less. Toronto Public Health has already decided to limit capacity to 75, with no more than 6 people per table, and each customer's contact information must be collected for contact tracing. For gyms and fitness centers, group exercise classes will be limited to 10 people, and the facility must limit its capacity to 50 people or less. For banquet halls and event spaces, they must limit to 6 people per table and have no more than 50 people in the facility at a time. My friends, this is serious. We have to offer our full support in every power possible to help our healthcare sector fight this second wave. The weather is driving more people indoors, which has led to more community spread and a surge in testing. As the weather begins to worsen, we can't have people waiting in the cold, waiting in the rain and snow to get a test. So today, we're announcing new changes to help the assessment centers get ready for the winter. Starting Tuesday, October the 6th, all assessment centers will be moving to appointment-based testing only in order for our assessment centers to make the necessary adjustments in order to winterize their operations. Beginning Sunday, October the 4th, assessment centers will not be accepting walk-ins. The vast majority of the assessment centers in Ontario that already offer testing by appointments will continue to operate as usual while we make this important transition. If you have already booked an appointment, don't worry, it will proceed as scheduled. Up to 80 pharmacy locations in Ontario will also continue to offer tests by appointment, with more pharmacies to offer tests in the coming weeks. While they transition, the assessment centers will also take the opportunity to conduct a deep cleaning. This will also give the labs a critical opportunity to clear the testing backlog. My friends, these changes are absolutely necessary. Being able to make an appointment, it gives certainty. It will make sure folks don't have to wait outside for hours. It will help us ensure necessary screening takes place to ensure those who need a test can get a test. And it will help us ensure we can get your results back sooner. We're working with our partners in hospitals and assessment centers to make sure this transition to testing by appointment is as smooth as possible. But folks, I have to ask for your patience as we make these changes. It might take a few days to schedule your test at the start, but we're working around the clock to keep those times as low as possible. We'll be adopting the latest testing technology and methods to allow us to test more people faster. I want to reassure people, the entire team at Ontario Health, the hospitals and public health staff, they're all working extremely hard. And I have to send a very special thank you. Thank you from the bottom of my heart to the incredible, and they're very incredible, lab technicians. Thank you to everyone who has been working tirelessly around the clock for months without a break to make sure we can keep testing people each and every day. Folks, these people have been unsung heroes. Thanks to them, we have done more testing than all of Canada combined. So please, if you know a lab technician, thank them for everything they've been doing. By working together and supporting them, we can keep people safe and turn the tide of this battle.